My name's Caleb Means. I'm Web Services Coordinator with Health Alliance Medical Plans. I've been with the company for almost 4 years and have been working with SupportPoint for almost 3 of those 4 years. As far as getting the planning and getting all this going, this is my second build with Carl now, so each one has been a little different. You kind of you learn your mistakes along the way. The first time through, Panviva actually had someone come out to do the blueprinting, get the initial information all going for the Carl Financial Services Department. I was there during that blueprinting process, which kind of gave me an idea of how that all goes down. And then with the second build that we've been doing here with the contact center, I was actually able to go through all that blueprinting process myself. The process flows are a little bit different for the 2 departments that we've implemented with Carl thus far. The first one was the Financial Services Department. They deal mostly with questions about their bill. You go to a doctor's office, you want to call in, you don't understand your bill, you need it explained to you. So they're mostly getting phone calls from the members, from the patients. But they also get a lot of calls from insurance brokers, perhaps other family members calling in regards to their patient. So those call flows, their jobs, I guess, are a little bit more answering those similar type of questions just about billing. Contact center, which is the second build we're doing here with Carl, a little bit different in that you're not dealing with the financial side of things. You're not trying to collect payments. That's what a lot of financial services is doing, is trying to collect money. With the contact center, these calls are all scheduling based. So maybe you're calling in to confirm an appointment you had, or to schedule something new. Maybe you want to talk to a referral staff member here. If you've got an MRI or a CT scan you've got scheduled, it needs to be authorized, calling to check on authorization statuses. So very similar, as far as like the blueprinting, it's all a very similar approach to get to the initial builds, but the process flows just change, ever so slightly, I think. Especially with this last build here that we're doing with the contact center, this has been, I couldn't have hoped for anything better as far as the engagement. This is a bigger group than the financial services we did last year. There were 25 reps on that group. This one we're looking at around 75, substantially larger. And we've got really good engagement with this so far. I know on the first day alone, as we were kind of walking the floor, making sure everybody who was using it, they were comfortable, didn't have additional questions, we would come back into our office in between breaks and stuff and check our emails, and we really preached the feedback to them. SupportPoint's got a great tool called Feedback, which you are allowed to send messages, suggestions directly to the authors. And on day one, we got something like 50 feedbacks out of those 75 users, and I think over the course of 2 or 3 days, we're probably around 100 feedbacks. One thing I tell the training staff about making processes better, or them helping to make the process better, is by giving them ownership of the product. So I'll often tell them in a training class that we've been spending 2 or 3 months in our quiet little room building all this stuff, and that's the main build. It's basically built. From here on out, you guys are using the system on a day in, day out basis. You're really the only ones who can help us keep the content current, keep it edited, look for gaps, things that we might have forgotten. So that is a key element to the training and the buy-in of the product, is to let them know that it's almost in a way I won't say their responsibility, but it's a great need of theirs to help keep the software going. And I think when they feel that ownership, and especially with being able to get their questions answered quickly, because with the feedback option that SupportPoint has, if they're running through a document and it's maybe it's a federal government type of document from the Affordable Care Act, a lot of changes go on with that. If we somehow didn't get a document updated that should have been, they send a piece of feedback through, let us know. We can quickly get that information loaded. We can reply back to them that it's been changed, it's live, it's fast. And so I think as long as you have a SupportPoint staff who are constantly updating this stuff and paying attention to the feedbacks, it's showing the users that their suggestions matter, their suggestions are being taken care of, and they're being answered and responded to quickly. Changes in SupportPoint are, we like to say in training, they're instant, they're instantaneous. So if there was a good example here in our last training that we did as far as updating phone numbers for certain branches or certain staff, there's another system that they used, which is where they would often access their phone numbers. It's a large process to get a number updated. It has to go on like an Excel spreadsheet, it gets sent to IT, a work request gets put in, and so there's a lot of work that has to be done in order for that number to get changed in that system. SupportPoint, as long as the feedback is sent through and they're telling us this number changed, we literally go into that document, change the number, hit save, and it's live. That change is live into the department instantly. To have changes happen quickly, especially in our business, especially with federal regulations and stuff like that, the alternatives to those type of things would be email, right? So a change comes through, you email your staff, here this has changed, start answering calls this way. The problem with that though is the ability to retrieve that information. If you're not keeping your inbox organized, if you're not putting emails into folders and keeping things organized, that information is hard to access. You may have forgot that it was even there. The reason it's better in a SupportPoint environment at least is because they can simply type in the keyword or the document title that they need, go to it, and they can always have confidence that it's the most accurate information available. Yeah, we have a lot of at-home users on the Health Alliance side. I don't believe the Carl side has any that I'm aware of, or at least that we have implemented SupportPoint with. I don't believe they are, but on the Health Alliance side, we are about 50-50. Currently, we do outsource some of our calls on the Health Alliance side. There was a period of time where, as the Affordable Care Act was coming through and we were taking on the exchanges and these Medicaid plans, we eventually took on the individual line. Our call volume started seeing a spike. So the leadership within customer service decided to take a lot of the calls that we would get, mainly like claim status calls. So you would get provider's office calling to see what's the status of the claim, has it been paid, is it denied, what's going on with it. We get a lot of those calls. It's a very high percentage call. They're typically easier calls to take. So we did, there was a company about 45 minutes away from our office, and it's a customer call center that handles all kinds of business, and we have 9 reps there that strictly answer these claim status calls. So it really reduces those number of calls that we have in our call center, and our reps can focus more on servicing the members. When we did the go live with this outsourced company that we used, we went over there, we worked with their IT department to get SupportPoint installed. We went through a normal training session that we would do with any new people using the product, and they've been using it ever since, and we still hear from them quite a bit and they submit feedback through fairly regularly, and I think they're actually eager to take more calls because they're taking the same type of calls all day long, and I'm sure that they would like to take some different type of calls, and I'm sure we're going to work towards that one of these days, because we do have support point, processes are built in place already, so, at any point in time, they probably could take additional calls. I think if we wanted to sort of cross train or bring different people over into customer service department, it isn't something that we have done yet, but I don't see any reason why that wouldn't be possible. We've, over the course of 3 years with Health Alliance, our call processes are pretty fine-tuned. We've been able to go through and edit and re-edit, and through all the feedbacks that have been sent by all the members or all of our customer service reps over the last 3 years. I would like to think that someone could come with some minimal customer service experience and be able to sit down at a computer, and as long as they've got support point going, they click the take a call button and they should be able to get right through it. In these instances here with our go lives with Carl over the last, this one here just last week, and then the other one back in November or back in October, we would just bring in the customer service reps in shifts. You got to have people covering the phone, so we would bring them in section at a time. We always allow for an hour. We usually do hour-long blocks. That gives us enough time to just go over the basic functions of support point, how to use it, how to navigate it and use the tools that are there, and then go in and start talking about more specific builds that relate to their jobs and what's important for them to use. You can get it done in about an hour. We usually allow at least 45 minutes for the talking, and then about another 15 minutes for questions. So it's such a user-friendly product that if you're familiar using Google or web browsers and things like that, you can adapt to support point very easily. If you are having any kind of gaps in your business, if productivity levels aren't where you want them or where they should be, if you're having any types of issues whatsoever, if you already have knowledge-based systems put into place and they're not working, if you're still not having the productivity that you need, you at least have to look at support point.